It's Denise's turn for a consult with Dr. Tornambe.
Okay, the first thing I would like to have done is to get my breasts larger. They're very small. I would like to be possibly a full B. I don't know that I would want to go up to a C, just so to be proportionate with my body.
Sure.
I would like my nose to be smaller, and then I would like to have my eyelids done. There's a lot of skin there that hangs down, and I feel like I have to open up my eyes really wide, and then I got all these wrinkles up here from doing that.
Let's start with your eyelids, because I don't think that's really your problem. Your brow has started to come down a little bit.
Okay.
You're young, and I'm hesitant to do anything too aggressive with you. I would prefer to do a mini brow lift. Make a little incision on either side of your brow and really just lift, and that's all I would do. I think that would be a very nice improvement. As far as the nose goes, I think if we reduce the size of the nose, reduce the tip, I'd like to just refine it a little bit, very conservatively.
Okay, so it'd be a subtle change, but it'd make a big difference.
Absolutely.
Okay. What about the red on the nose? It's always very red.
It is always red. That's kind of like your complexion. I don't think that's anything that right now that we can really take care of.
Okay.
Now, as far as your overall complexion, though, there's other things we can do. Over the course of the next 4 to 6 weeks is do microdermabrasion.
And what is microdermabrasion?
Microdermabrasion is really a very fine sandblasting of the skin.
Okay.
All it does is remove the outer layers of skin.
Okay.
It kind of feels like a rubber band snapping against your face a little bit. And in combination with that, do some very light chemical peels. And what that will do is resurface it very nicely. So Denise, if I may, can I take a look at your breasts now?
I've not felt comfortable not having breasts. I don't want big boobs. I just want some.
I completely agree that a B cup size for you would be perfect, because I think anything bigger would look unnatural.
Would allow me to have cleavage that way.
Absolutely, absolutely. You definitely have cleavage. She was extremely concerned about her breasts, and when I examined her, I said, I've seen a lot of ladies that are flatter than you. You have breast tissue on a shoulder. So we could make a very tiny incision here and put the implant in through here, and that would not show because the breast would then come down and cover it.
It's nice because he didn't say I was deformed by any means, so he actually seems smaller. I have folds and stuff. I was like, yes.
Denise will be getting breast implants, a nose job, a brow lift, chemical peel, lip augmentation, and porcelain veneers.
I think to myself when I put this on, it's more like, what would that look like with boobs in it?
Now it's Denise's turn to begin her extreme makeover.
I looked at myself and said goodbye. And I said goodbye to my nose. Because you know how a kid feels the night before Christmas and they can't go to sleep? I mean, I wonder what I'm going to look like, but I'm ready to see the new me.
I thought that Denise was a very pretty girl that had a few minor things that, with a little bit of surgery, would make her just more pretty. We're going to shoot for a B cup size. Nothing too big because you're petite. We're just about set.
Dr. Tornambe marks Denise for her surgery.
Okay, kiddo, you're ready.
My dreams are coming true today, girls. All right. Any good thoughts? You're going to drift off to sleep, okay?
What we're going to do is start off with the breast surgery. We roll it up sort of like a cigar. Most of the time, I prefer to place the breast implant under the muscle, primarily because mammography is much more effective. Nearly 100% of the breast can be seen. So all I'm going to do is make a teeny incision right in her brow. I'm going to put a stitch that's just going to bring this up ever so slightly. We're also going to infiltrate the nose. It's going to be an open rhinoplasty. We're actually working inside the nose part of the time and outside of the nose. The actual last thing we do will be the chemical peel, which is the final touches. Okay, that's it. Okay, we just finished the peel.
The surgery over, Denise is wheeled into the recovery room.
I think it went very, very well. I think she's going to look awesome in clothes. I think she's going to look awesome in a bathing suit. She has a great little figure, and all this is going to do is enhance it enormously.
By the time Dr. Tornambe visits Denise 48 hours after her surgery, she has grown anxious.
How's it look?
Look
Does
great.
it look good?
Yeah, you look really
Hey,
good.
sure, it's good. Look okay?
She's also ready to have the restrictive bandage taken off her head.
Oh, yeah, that feels good. Oh, I hated that thing.
It's Sunday afternoon. We're just about at the 48-hour mark.
Okay.
And you're looking good. You're puffy, but that's normal. And this, what's going to happen, your face, you look kind of like sunburned and ruddy looking. That's just skin that's going to peel and flake off, and it's going to feel really good. Okay, let's take a look at your breasts. Okay, you look great. The sizes look good, and they're already starting to settle a little bit, but you're there. I'm telling you, you're 4 days, you're way ahead of schedule. Everybody who has this kind of surgery wants to be better yesterday and wants to be perfect yesterday. But again, the body has to heal, and it takes time.
First, Denise goes back to Dr. Tornambe for dermabrasion, which uses a refined sand to vacuum away layers of dead and damaged skin.
It's very relaxing having a dermabrasion done. It doesn't hurt at all. And I like the dermabrasions, they're very nice.
Radiance injected into her top lip. Collagen only lasts 3 to 6 months, which is why Dr. Tornambe uses Radiance.
Denise just really lacked fullness in the central third of the Cupid's bow. All we really wanted to do is just plump him up a little bit.
And this was Denise Cochran just 6 short weeks ago.
I had someone write in my yearbook, ashes to ashes, dust to dust, why do you wear a bra when you have no bust?
In Kansas City, Denise is speeding towards her big reveal party.
I feel very beautiful right now. I feel like the lucky girl. It's been a lot of fun, but I'm ready for it to be over. I want to go home and snuggle my babies.
All of her family and friends have gathered to see her gorgeous new looks. Everyone is anxiously awaiting Denise's imminent return.
I'll be relieved to get her back home in my arms, in my house. I mean, 6 weeks doesn't seem like a long time, but it is. It's been forever. I missed her so much you can't even describe it.
I haven't slept. I think a lot of people haven't slept. We're just all really excited, and there's just lots of butterflies in our stomachs.
She was beautiful before she left, but this is something she always wanted. It's her Cinderella night, and she deserves it.
For Denise, it's now time to take off the wraps and show off her incredible new looks.
I'm speechless. I never thought she could be more beautiful than she was before. She's just, well, you've seen her. Beautiful.
I felt excited and happy, and I was crying because I was so happy, and I had missed her so much, and I was very excited to see her back.
Are you? Oh my gosh, you look great!
I didn't know what to visualize, and then when she came out, I was like, oh my God.
Why are you still crying?
I'm not crying.
Stop! I'm not crying.
I am so happy because she has wanted this for so long, and I'm so happy because she's so happy.
Denise had a nose job, a brow lift, chemical peel, breast augmentation, microdermabrasion, a lip augmentation, and a complete dental makeover, which included gum contouring, new bridge work, and porcelain veneers.
I see a totally different woman. I'm very happy. I feel very beautiful right now. I feel like the lucky girl. It's like nothing you can imagine. It's amazing. I wish I would have done it years ago. It's still kind of like not real. It's like pinch me. It may take a little while for it to set in.